All right, which of the following patients is at risk for having a sodium level of 130 milliequivalents per liter? So remember, normal sodium is 135 to 145. So who has a low sodium? Sodium problems are usually a water problem. That means I am diluting my sodium. I have a lot of water. Sodium problems are water problems. I have a lot of water diluting my sodium. Client with hyperaldosteronism. So hyperaldosteronism is basically I have too much aldosterone. What Aldo likes to do, Aldo likes to save sodium. He saves sodium, so it actually makes sodium go higher at the kidney. And he kicks out my potassium. Aldo saves sodium, kicks out potassium. So if I have hyperaldosteronism, I'm actually going to have high sodium. So this can't be it. Hyperaldosteronism, no. Client taking in diuretics. Yeah, you pee out a lot of sodium with that. So that could definitely a possibility. Let's see what's next. Client with Cushing syndrome. Cushing means you have a lot of steroids. Remember aldosterone's a steroid? Clients with Cushing syndrome, they have steroids too. You have a lot of steroids, cortisol. It's a steroid. And it does the same thing. It does like Aldo. It saves sodium. So it increases, it saves sodium, loses potassium. So my sodium is going to go up. Sodium is going to go up with steroids. All right, because I'm saving it at the kidney. Client taking corticosteroids. Oh my gosh, this is like 3 ways of saying the same thing. All these guys are steroids. All those guys are steroids. They will increase my sodium and drop my potassium. So best answer, client taking diuretics. The diuretics is the answer. That's the guy. All right, the nurse would expect to see the following signs in addition to flat neck veins. So this person's dry. Flat neck veins are dry. Generalized muscle weakness and diminished deep tendon reflexes. And a client with suspected hyponatremia due to high diuretic use in heart failure. So they had heart failure, their pump didn't work, you gave them diuretics, you dried them out, and they lost a lot of sodium in the process. So what are you going to see? Muscle twitching? No, typically seen with hypernatremia. And remember, also low calcium too. Enhanced bowel sounds? That's definitely possible because you've lost all your sodium. And what your body does is it tries to send all the water to the bowels, and it makes them actually get irritated and they work a little louder. So yeah, definitely can be seen with low sodium. Decreased urine output. You're dry. You have flat neck veins. You're flat neck veins. You're dry. You think you're going to pee out stuff? No. You're not going to pee anything out. All right. Elevated specific gravity of urine. That elevated specific gravity, think of it as density. It just means density. How dense is your urine? How concentrated is your urine? Probably a better way of saying it. The concentration. So high concentration of urine. You think that's what's going to happen here with low sodium? Low sodium means that your body's trying to, if you have hyponatremia, your body's trying to save sodium. So when you pee out, when the kidneys are making the urine, they're going to want to save as much sodium as possible in the body. And they're going to, so all the solutes will be in the body. Very little solute. It's not going to be very concentrated. So it'll be low specific gravity and hyponatremia, low. It'll not be concentrated. Remember, the sodium has a lot to do with concentration. So that's going to be hanging out in your body because your body's trying to save it. So that'll be low concentration or low specific gravity. But here it's saying elevated, so that's wrong. That would be seen with a hypernatremia. All right, cool. The nurse examines a patient's lab report and sees that their serum phosphorus level is 1.7. What's the normal phosphorus? It's about 3 to 4.5. So we're definitely low. Which disease is most likely the cause of this low level of serum phosphorus? Now, when you think of phosphorus, what's the first thing that you should always think of? ATP. Phosphorus. That's the adenosine triphosphate. ATP. That's that P right there. You got a low P. So low energy, low food. What's going on? Kidney failure. What do your kidneys do? Kidney's job is to get rid of phosphorus. Get rid of the phosphorus. So if your kidney's failing, are you getting rid of it? No. It's staying in your body. You're going to have high phosphorus, so no. Here, this patient has low. They have 1.7. We have 1.7. All right. Malnutrition. Hey, yeah, no food. Remember ATP, that's food. You need food, energy. ATP. Oh, never mind. That's actually a good answer. I like that one. High parathyroid hormone levels. Remember, parathyroid, PTH, goes to the bone and will take out phosphorus from the bone and make your phosphorus levels go high. So High parathyroid will actually increase your phosphorus levels in the bone. So no, it takes out PTH will take out phosphorus and calcium from the bone whenever it's low. Tumor cell breakdown syndrome. So all our cells, whenever you get cancer drugs, your cells die. Your cells are a bag of potassium, they're a bag of uric acid, and they're a bag of phosphorus because they have ATP. If their cells burst, they're going to release all this phosphorus, all the potassium and all the uric acid, so it would be high. Here we have a patient that has low, so this can't be the possible. This cannot be the answer. So what's the answer? Malnutrition. Got some food, man. The nurse reads the doctor's note in the patient's file and sees that the doctor has recorded an estimated 820 mils of insensible, meaning I don't feel it, fluid loss daily, insensible losses. The nurse plans to keep an eye on the patient, understanding that insensible fluid loss is eliminated through what means. Insensible means I can't feel it. Urine output. Can I feel my pee? Yeah, absolutely. I know I'm peeing. I know I'm losing fluid. I can see it. Skin excretion. Do you see yourself sweat? Do you always notice yourself losing water through your skin? No, you don't really notice that throughout the day. It's happening though, but you don't really notice it. That is insensible. You don't feel that. Insensible. Drainage from wounds. Yeah, I can see fluid draining in wounds. So no, that's not insensible. The digestive system, when I poop, I can see that in the toilet. Skin excretion, I typically do not see that throughout the day. So that is insensible. I don't feel it. All right, the nurse is in charge of caring for several patients. Busy nurse. After reviewing their medical records, the nurse determines which patient is most likely to face a fluid volume deficiency. Fluid volume deficiency. Who's going to be dry? Dry and light. Patient with a heart condition. No, the pump ain't working. Blood's getting, fluid's backing up into the heart. You will be wet and heavy, so no. Patient with ileostomy. That is a source of where fluid can be lost. So yeah, that's there's a hole in your body. You can lose fluid that way. So that's possible to lose fluid that way. Patient taking long-term steroid medication. Remember, steroids make you, they swell you up. They save sodium and they lose potassium with steroids. But what comes with sodium is water. So you swell up. So no. A patient undergoing frequent wound flushes. You flush wounds with water. So you're giving them water all the time. You're giving them water so their water will go up whenever you flush the wound. Wound flushes. That has water. So no, the only one where you lose it is through an ileostomy. The nurse is taking care of a heart failure patient. Pump is broken. Fluid is backing up into the lungs. Into the lungs. Into the lungs. Who has received IV diuretics. So they're peeing out on the fluid and believes the patient is facing a fluid volume deficiency. So now they're dry and light. What signs would the nurse observe in a patient with this condition? Clogged lungs and a fast heartbeat. If they've lost fluid, their lungs can't be clogged. You unclogged it. And they can have a fast heartbeat, but definitely not clogged lungs, so no. Low red blood cell count and increased urine production. If I had a lot of fluid, I'd pee it out, so I definitely don't have that. Low red blood cells. If I was with a lot of fluid and I diluted my red blood cells, so if I had like 5 red blood cells and I had so much fluid, then it could be diluted. But here we have low fluid, so it's actually concentrated, so the red blood cell would probably be a little high. Weight loss and dry skin. Hey, dry and light. Sounds pretty good. Rapid breathing and high blood pressure. How can I have high blood pressure if I have no fluid? I need fluid for the pressure. Rapid breathing. Not anymore. I got all the fluid out. I diuresed my guy till he's lost weight and dry skin now. So there you go. After reviewing the patient's medical records, the nurse identifies which patient is at risk for fluid volume excess. Who's going to be wet and heavy? Wet and heavy because they're full of fluids. The patient taking diuretics and has skin that sticks up when it's pinched. That's a dry man. That's the Sahara Desert right there. So he's taking diuretics. He's peeing everything out. He's dry and light, and his skin tense up. He is dry. Give that man some fluids. The patient with kidney disease caused by diabetes. What does the kidney do? It's a filter. So if it can't filter water or fluid, it gets backed up, and you get wet and heavy. So, will that patient have fluid volume excess? Yeah, probably, yeah. Patient with an ileostomy from a recent abdominal surgery. Remember, an ileostomy is a hole. You can lose fluids through holes. So, no, you'll get dry and light. The patient who needs periodic gut suctioning. So, I'm taking fluids out of this guy all the time. That patient's going to get dry and light. They will have fluid deficit. So the only answer here that makes any absolute sense is the patient with kidney disease with the filters broken. Okay? All right, which patient is likely to have a potassium level of 5.6? Remember, normal potassium is 3.5 to 5, so we're on the high end. Who has hyperkalemia here? Patient with colitis. Colitis means my colon is inflamed. I'm pooping like crazy. Remember, when you poop, you lose potassium through your poop. So no, this patient will have low potassium. Patient who has suffered a burn injury. Remember, cells are bags of potassium, uric acid, and phosphorus. If I have a burn, my cell will burst and it'll release all the potassium. So my potassium will be high. So this is definitely a possibility. My bag of potassium. Cells are bags of potassium and an ocean of sodium. That's how you should think of the body. Sodium is on the outside mostly, and potassium is mostly on the inside. Patient has suffered a burn injury. Yeah, I've broken my cells. Potassium is going high, so that's definitely a possibility. Patient with Cushing's syndrome. What is Cushing's syndrome? It means I have a lot of steroids, cortisol. Cortisol, steroids, they go to the kidney and tell them to save sodium to the body and lose the potassium. So if I have a lot of cortisol, I will lose potassium and I will have low potassium. So no. The patient who has been taking too many laxatives. So they're like the colitis guy. They're pooping everything out, and when you poop, you lose potassium through your poop. So no. That'll be hypokalemia. So the patient suffered a burn injury. All right? Easy.